Welcome to the Rio Grande Valley, a four-county region in South Texas home to about 1.3 million people who live sandwiched between the U.S.-Mexican border and a series of interior border control checkpoints where agents monitor travelers making their way into central Texas. In the valley, access to safe, legal abortion care disappeared in November 2013 after conservative lawmakers passed HB 2, the anti-abortion bill famously filibustered by Wendy Davis. Now, at the Whole Woman's Health Clinic here in downtown McAllen, the poorest city in the United States, a skeleton crew keeps this former abortion clinic open, seeing patients before they travel hundreds of miles round trip for safe, legal abortions. So, how many patients are you guys going to see today?
Oh, on schedule we have like 6 or 7 pre-ops. One's already come in, but she was an IUP. She was too early. And then we just have our second pre-op right now. We have follow-ups. Some patients just come in for information, but I'll ask if they want to stay, just so we can get a big chunk out of the way. And actually, it does help a lot because we get their paperwork out of the way. We do everything that they need prior to their abortion, and then we'll actually, we'll scan and we'll fax everything to the other clinic. So by the time they get there, they know how much, they're going to pay.
Whole Woman's also helps patients with gas cards or bus tickets to assist them in making the 8-hour round-trip journey to San Antonio or the 10-hour round-trip journey to Austin. I talked with Andrea Grimes, the corporate vice president at Whole Woman's, about the challenges that many Valley patients face accessing legal abortion care. And that's only if they have the documents to get them past the Border Patrol agents who stand between many Valley residents and legal abortion.
So we're talking about transportation, we're talking about childcare, we're talking about possibly lodging if you can make the trip back on the same day. We're talking about gas money, bus tickets, the cost of the procedure. That type of logistical planning is some of the things that we are offering right now, and those are the steps that they have to go through. And we're talking about people that are able to make that plan and have enough support to where that could happen. It's not the case for the majority of people.
This is all happening because of HB 2, the omnibus anti-abortion bill that Texas Governor Rick Perry had to call 2 special legislative sessions to pass. It does 4 things. It bans abortion after 20 weeks. It requires doctors to prescribe medication abortion in higher, less effective doses according to 13-year-old FDA regulations. It requires abortion facilities to meet the standards of ambulatory surgical centers. And it mandates that abortion-providing doctors obtain admitting privileges at hospitals within 30 miles of where they perform their procedures. It's the admitting privileges requirement that ended legal abortion in the Rio Grande Valley in November 2013, when the valley's abortion-providing doctors, who have been providing safe, legal abortion care in the area for decades, were forced to stop providing legal abortions because they hadn't yet, and have not yet, been able to secure admitting privileges at local hospitals in this deeply socially conservative area. The heavily Hispanic Valley is a different shade of blue in this red state. It is a warm, welcoming, and complicated place affected by systemic poverty and an increasingly militarized border with Mexico. But the Valley's people speak of it with a fierce love and loyalty.
My name is Nancy Cardenas. I grew up in the Rio Grande Valley. I lived in Mexico for about 4 years before coming to the Valley. My parents chose to come to the States because they wanted a better life for me and my little brother. And so I've been raised in the Valley ever since. I recently came to Austin for UT, and I just graduated with a double major in government and international studies. I think the Valley's just, it's home. It's the home where we grew up. It's the home where we were raised in. It's the home that our parents fought so hard to, cross over to. It's the home where our parents invested all of their hopes and dreams into our future and left behind a life in Mexico that, they look back on from time to time.
It's not like any other border. It's not like any other frontier. It's very original. And like I said, it's very rich. I mean, it's just, I love it. I love how people talk. I love the music. I love the food. It's very much of that area, right? So I find it so charming.
Many thousands of Valley residents live in colonias, which are often unincorporated areas and neighborhoods with little or no access to sewer systems, electricity, and waste disposal. They struggle to make ends meet. There is little public transportation, and legislative budget cuts have decimated the safety net that once provided affordable, and sometimes free, cancer screenings and contraception for women in the Valley. Paula Saldana, a healthcare educator in Brownsville, has seen the effects of these budget cuts firsthand.
My sister's like an example. I'm going to use her as an example, and one of our patients that I just saw last night, she has an 11-year-old, and then she came up pregnant with her, and she was fine. And she was a Planned Parenthood patient. She would get her birth control there, her pap smears, but then the cuts came, and she had to pay. And she was like, okay, so it's my light bill or my birth control.
Right.
And in between her deciding, she got another one.
Recently, an independent coalition of reproductive health care providers, including some Planned Parenthood clinics, applied for a federal Title X grant to reopen some clinics in the Valley. Thanks to that grant, this 50-year-old Planned Parenthood clinic in Mission, Texas, has reopened its doors. But there is still a long, long way to go.
We were affected the most of all the areas in the state, and primarily our affiliate in Planned Parenthood, because we were doing quite a bit of preventive work, a lot of prevention, wellness exams, pap smears, cancer screenings, birth control. We were helping many, many women, over 23,000 women back in 2011. And then the snap of a finger, they took away almost all that funding for the women. So
for many in the Valley, it feels as though their lives are not valued by state lawmakers who willfully turn a blind eye to the damage that bad policies are doing to some of the most marginalized Texans.
Absolutely correct. And I think we saw that especially during the special sessions when women from the Valley couldn't physically be there. I mean, most of the people there had the luxury of living 15 minutes away, even 2 hours away. And it's not like there wasn't some kind of concern coming from Valley residents about this law, because there was. There was protests, there were events there that were being held at the same time during the special sessions. But because legislators didn't physically see a presence there, that was just kind of enough for them to say, well, this isn't a big deal. This isn't really going to happen, And so I think it's just so much disconnect. And I think Valley residents don't deserve that. I think we deserve more respect, and I think we should be acknowledged that this is an epidemic, and this is a crisis in the Valley. Women are being resorted to kind of dangerous conditions and kind of dangerous alternatives to relieve their pregnancies, and I just think that they should open their eyes and realize that this is a bigger issue than they think it is.
If they cannot travel hundreds of miles for a legal abortion, Valley residents may cross into Mexico if they can to obtain abortion pills or try to find them at local flea markets. But in September, all 4 tenets of HB 2 will go into effect, leaving Texas with just 6 abortion providers in the entire state, located in 5 major cities along the state's main highway corridors. What's happening in the Valley is about to be happening in smaller metropolitan areas across Texas.
So we are forcing women and their families to take desperate measures. And the consequences of those actions are going to be, things that they're going to have to deal with in the emergency rooms in the Valley. In order for us to regain a safe access, is going to take a while. And I think that there will be casualties, unfortunately. And it's the saddest thing is that it has to get to that point for people, in government to notice and stop trying to practice medicine. It's definitely not, HB2 is not addressing any type of public health crisis, but what is coming, unfortunately, is going to be a huge crisis in the Valley.
In January 2014, Whole Woman's McAllen would have celebrated its 10th anniversary providing compassionate legal abortion care to people in the Valley. Now, they struggle to stay open as their former clients are forced to look elsewhere for health care.
This is how it affects me. That's your question. This is how it affects me. It's just sad. It's just very sad. There is such great potential in the Valley. People deserve so much better. Women deserve so much better. People in the Valley are fighters. They face obstacles consistently in so many levels, and it doesn't keep them down. People work really hard. People fight for what's right, and I think that we've enjoyed so much being part of that fight, and to be at this point, particularly today, right on our 10th anniversary of offering great services and having great relationships in the community, that we're not able to do and offer the services that we are so good at and the women deserve. You know, places where you can come as you are, and we can talk about what really matters most to you, and be able to leave our clinic and go back out in the world and be the person you want to be with, and feeling that you don't have to fear judgment because you're great as you are. Not being able to do that in the Valley, it's heartbreaking right now. So